started. The copy of the Open Meetings Act is located on the wall here at the entrance of the room. We have 5 items today on the agenda. The first, discussion and consideration of health insurance administration proposals and next steps.
Okay, well, I can start. So, the county did an RFP for a health insurance plan administrator. Currently, we have United Healthcare. The county received 3 proposals from Aetna, Blue Cross, Blue Shield, and United Healthcare. We have Tracy Krause from Aon is our contracted consultant, and Aon's in the process of reviewing the proposals along with some internal staff. So we're not prepared to discuss the contents of the proposals today, but we wanted to talk about the process of moving forward in the review process. So the next step would be to interview all 3 companies, if that is what the county board wants. So that's what we'll do. And I believe those are scheduled for when?
17th and 18th.
We'd like to schedule on the 17th and 18th.
So August 17th and 18th. Obviously, any commissioners that would like to attend are free to do so. And is that going to be in this room? Do we know yet? Probably.
I'm not sure. I think
okay.
so.
Well, we'll probably have it in here.
Both days, I believe, we're here.
Okay.
I'm going to be out of town for sure on the 17th, 18th.
Okay. It's a really tight window, so we would like to go ahead if we could with the interviews. We're really backing into a date. I believe that things really need to be approved. Hopefully on the August 30th meeting, county board meeting. Is that right? Are we having an HR? What's the next step?
The next one is a committee meeting.
23rd. Right.
So
And
we
then
have the interviews on the 17th.
and then county board approval on the 30th.
Right.
So it's a pretty tight time frame, so we can get ready for open enrollment. So that's basically the process, unless anybody else had anything to add or have any questions.
Okay, any questions, Commissioner Warner?
Is it appropriate to ask what the difference of the proposals are, or is it this time we're not supposed to?
I'd rather not to get into it now because we are in the process of reviewing them, and so we'd like to do that the next committee meeting, which is on the 23rd.
Okay.
Now, obviously, I mean, I can share those with the commissioners, during the week if you'd like, but I'd really not like to get into it now.
Vote on this, or
The 30th.
The 30th.
Yeah, that would be the strong preference.
You'll have a recommendation from the HR.
Yes.
Okay, and then when will Aon, will they be at the meeting the 30th to talk about it?
We'll be at the 17th, 18th, 23rd, and 30th. We'll be at all those.
And again, I'm probably saying some things that maybe aren't appropriate to say at this point. I haven't seen anything yet. The only thing I know, in the city just changed from Coventry to someone else.
Well, they changed from Aetna, which purchased Coventry, but the players are all the same. So they changed from Aetna / whatever, if you want to call it, the old Coventry, to Blue Cross, I believe. Or they're in the process of making that change.
Right, I don't know if, I mean, that's the word on the street. I haven't
Yeah,
heard
but
anything
they're
official.
changed. That's what I've heard too.
Mhm.
The only thing is, for us, anytime you make some change, it's a little disruptive to our
Yes.
people.
Yes.
And I think I'd make the statement that for me, I think what we're supposed to do is not necessarily always take the low bid, but the best bid in our opinion.
And it's not a bid. It's not really even low and
Or a
best bid
proposal.
because it's a proposal. So really, all bets are off when it comes to what you're statutorily required to. It's really what you believe is in the best interests of the county
And the employee.
and the employees. Right.
Right.
And there are 2 components. Administration is one, so what they want to charge you for, processing the claims, but the other piece is the discount analysis that we'll do, that the commissioners will sign on the 16th, like a non-disclosure agreement, so we can run your claims through our proprietary database and then show you guys if it's $1 with United, it's $1.03 with UHC, or it's $1.04 with Blues, or whatever that
Right.
will be. So, and that's the bigger piece, the claims discount.
So I think I'm open-minded about it, but to me, I want to do what's best for our employees, and there's a part of me that thinks the consistency's kind of nice, but there may be justification, reason to look at this, but we'll go from there.
Any other questions? Commissioner Duda?
I can tell you from experience that it is painful to switch. It is hard on employees, and you kind of need a pretty strong reason to do that. Again, I'll be anxious to hear what they come up with, but you need a compelling case. We did that once years ago, switched to Blue Cross, and then the next year things went way up, and we were ended up being kind of sorry we had done it, and it was disruptive to a lot of employees.
But this, I just want to clarify, this first item that we're talking about is just for the administration of those claims. We're not talking about changing health plans yet.
Yeah, that's what we're talking about.
The
Like,
benefits,
the administrator
would
is
stay
the health
same.
plan, basically.
So
Right.
the plans would stay the same. The 600
But it's the
plan,
carrier.
HSA plan, the carrier
Right,
would change.
but-
Right.
This is only, Marianne, this is just the discussion on what the next steps are that we would like to do, interview the carriers. And
Right,
then
but-
from,
But, so tell me, so we have two items here. Oh, that says life insurance.
Right.
Yes, I should
That's
put my
different.
glasses.
So that's next.
Should put my glasses on.
Yeah.
Okay, sorry.
it's just what the next steps are, to give an approval from the county board to interview those three
Okay.
companies next week, and then bring back to the 23rd our recommendations as a staff to that HR committee meeting, with the hope that you vote on August 30th.
Okay,
Right.
all right.
Yeah.
So, sorry.
So it still is what we said.
Yeah, it was.
What Claire said is exactly where I am. Maybe didn't say it as clearly as you stated it, but that's my concern exactly.
Yep.
And that's why I've mentioned the employees several times,
Yeah.
because I think it does cause some concern, and I wanna be sure Karen, gives us her good voice of HR experience and expertise too. And then we listen to Aon, and that's what we're lucky to have as our consultant.
Okay, any other questions or comments? So everybody has the process. Let me put my glasses on. For the health insurance. Everybody has the process now.
Yes, we're good.
Okay, all right. So we'll move on to item 2, which is regarding life insurance proposals.
Kathy, you want to take
Yes, we did go out to bid for the life insurance. We have had Minnesota Life since 2005, and quite frankly, they have done a very good job. In fact, over those years, they had lowered our basic life coverage. They extended up to $500,000 for the supplemental for the employee. They added spouse supplemental, which was a flat amount for many years, or as long as I've been here. And they also added supplemental for the child. Unfortunately, over the last 2 years, our experience rating has completely gone out of the roof. Probably in my 23 years here, I don't know that I've ever had any more death claims in the last 2 years than we had. So with that in mind, when we got the renewals from Minnesota Life, they were quite high, and staff recommended that we at least go out and see what was out in the market. We did get proposals back, and I don't know, Tracy, how many were there?
8.
Yeah. And out of the 8, 2 of them were better than all the rest, significantly, and much better than Minnesota Life. Those being Voya and Minnesota Life.
MetLife.
Not
I mean,
MetLife.
excuse me, MetLife, thank you. And with MetLife, they had a lower cost for their supplemental for the employee, which is an employee cost, not a county cost. The basic life was higher for MetLife, and so we looked at it from a county out-of-pocket expense, which is your basic life and your accidental death claim, and that was lower with Voya. So staff really would like to recommend Voya for the new carrier for next year.
Do we have the, spreadsheet of do we have that?
So an annual premium.
I mean, to
Did you
show,
make
to
copies?
pass out?
I can make a copy.
We should have probably done that. I wondered
That would
if
be
you had
easier to
copies of
follow,
that.
I think.
Yeah.
Do you want to make?
When we did go back, I think Tracy went back to them, both MetLife and Voya, And Voya came back and reduced the supplemental, which is again the employee cost, not the county cost. MetLife.
I let Jolene do all that negotiating. She's the tough
Yes,
cookie back
okay,
there.
yeah. So MetLife did not, theirs was final and best. So with that in mind, because it's a county cost for the basic, by far Voya was the best. And then when they came back and reduced the supplemental for the employee, we just felt that Voya was probably what we would recommend.
They used to be ING, if you see those commercials when you're watching.
Yeah.
So that's the name. I mean, I don't want to say recent. It's probably been Voya for a few years, but nobody recognizes Voya. They recognize the ING commercials.
And you know, they're also the ones who administer our 529 plan.
457.
457, yeah.
And Patrick will bring it. Your current annual premium on the basic life is $73,000. Your renewal with Minnesota Life went up to $106,000. And the proposal from Voya, which is their best and final, is $79,000. So it's still an increase, but like Kathy said, your experience hasn't been great the last 2 years. So
And we got a 3-year
Guaranteed.
guaranteed, so that, it's not like we're gonna take the lowest for
And then
next
have 'em
year
switch
and
us.
then be bumped up, at least we have a 3-year guarantee renewal. And so, and really from the employee's perspective, it's really irrelevant, because if there's a death claim, we process it here through the insurance carrier, so it's irrelevant to the employee as far as if it's Minnesota Life, it's MetLife, or who it is, basically, differently than your dental or your medical. They're really far removed from that, other than, just wanting to know what kind of level of coverage that they have. So
That hasn't
it's
changed.
no, the coverage is
level of
identical.
no,
coverage.
they gave the proposals based on what our current,
What the current-
yep. Yep.
Here,
So
Mr.
that-
Rogers.
I was curious, did Voya buy ING? Because ING was involved in the,
Yeah, I think Voya purchased them.
No, what happened was, ING is a big Dutch financial company.
well,
And they
ING
spun
in
off.
2007, weren't they the first, didn't ING trigger all this financial recession stuff?
Well, they're a big so they're in a bunch of different financial businesses. And like I said, they're primarily a Dutch company, so they spun off their North American operations. They did a tax-free spin-off, and they renamed their North American operations Voya. And so now it's a freestanding company that I think is traded on the New York Stock Exchange. So they've severed their ties, but it was really done as a corporate spin-off.
So you can see that first column to the left in like yellowish is your in-force rates. So currently, annually, it's $73,241. That's what the county pays, and then the voluntary life. I'm sorry. Current today, your annual premium, and then the voluntary life, which is employee paid, is $391,074. And so you can see the Minnesota life, was an expensive renewal. Voya's all the way to the right. So again, the county would pick up the $79,519, and your employees can purchase that supplemental coverage. And if we took who has what today and put that with Voya, it would be $473,291.
Is the quote here, just to clarify, is the quote here for Voya on the supplemental, does that include the new rate, or is this at the original rate?
That's the original.
Yeah, so it's actually
Better.
reduced over that,
Less.
yeah, that's what I was thinking.
Commissioner Morgan, did you have
No.
any?
There was a request, I think, by the county board or somebody from the county board that wanted us to consider not having, see what the quote would be if we didn't have accidental death and dismemberment. And I don't know what the difference was, but I'm reluctant not to offer the accidental death and dismemberment. It's basically the same level of coverage as the basic life, which is $15,000. And in my tenure here, we've paid that out 3 times for accidental death. So I don't know of an employer that doesn't carry accidental death. So I just wanted to make sure that you understood that we did look at that, and it's such a minimal cost that
We kept it in.
I think it's
$10,000 a year.
it's pretty much worth keeping.
Anybody else? So this will go on the board next week, could it, or
Same time as the health insurance, probably.
We
right?
thought we
Just
would
the
just
same
do it
time.
all at one
Okay.
time.
till the 30th?
It would be effective January 1st, 2017.
17 for 3 years.
Okay, all right. And any other questions or comments? Next is a discussion regarding renewal.
Delta Dental is our current dental carrier. I think we've had them now for, this is our third.
2014
Yeah.
started.
And they came back with a renewal with a flat, no increase. And we would recommend that we keep Delta Dental for another year, or another 3-year contract.
They offered 3 years at the same rate of $3.05 per employee per month. It's been $3.05 since 2014.
Okay,
Sounds good.
all right. And that will be on the 30th as well. And then discussion regarding agreement with Union Bank to administer the county's HSA plan.
Now that's something that, of course, the one commissioner that really had a keen interest is not here today for that. But that's, if you still want to talk about it and vet the whole thing, Kathy can do that if you want to.
Yeah, we may have to brief him, but that's fine. Go
You
ahead.
want me to go ahead?
Uh-huh.
Okay, so, I was here back in July, I think, talking to the board about this issue. Currently, Union Bank hosts the county's, health savings account plan, which is the high deductible plan that about 50 employees participate in. And, they've been hosting that since its inception, which I think was around 2010. It used to be they did not charge monthly maintenance fees to the employee. That changed over the years to about $20 a year was the annual fee, and recently, back in July of this year, they upped it another $4 annually, so it's now $24 a year for the employee. And that prompted a discussion about, well, maybe we should look around and go to a different bank. I did provide some information last time, just preliminarily from other banks. Yes, there are other banks out there that would do this without the maintenance fee. There's a couple, however, there may be charges from Union Bank to move to that other bank, so it kind of ends up being a wash. There's a $20 fee to move. So the discussion was going towards, well, what if we were to stay with Union Bank for a couple more years because they're going to freeze their rates. They said we will not raise them again until 2019. And then prior to the end of that, perhaps go out for an RFP and do it in a more global way, because there's other things that banks offer the employees for, as far as investing this money, and it gets a little bit more complicated than just the monthly maintenance fee. So I do have a contract that they sent over, and that would freeze this rate until the end of December of 2018, and I just wondered if you wanted me to go ahead and put it on the board's agenda.
Yeah, I did have a discussion with Commissioner Boyle about that sheet, and we went through it, and then if he hasn't, he may want to come in and talk to you a little bit
Sure.
more about it,
Yep.
but, in the end, he was okay
Okay.
with just staying.
I thought so, I
And
just
then
wasn't-
moving what you just said.
Okay.
In the future, so I think we're okay.
Okay. I just wanted to make
Yeah.
sure I kind of followed up on it, so.
Yeah.
Okay.
Yep.
Sounds
Yep.
good. Thank you.
We do have other business.
Other business?
So the issue regarding wellness incentive, and I'll have Kathy Adair explain how we used to do gift cards, and then they became taxable, and that was an issue. So there's an alternative that Kathy would like us to consider.
Basically, most employers that offer a wellness program, it's based on a premium incentive as opposed to just giving them cash or a gift card or whatever the case might be. Never became an issue given those gift cards until we came to the conclusion that it has to be taxed. And believe me, if my email box didn't get overloaded and my voicemail with very, very disgruntled employees, that they were going to be taxed. And we started taxing them on the one that they earned in 2015, and it was paid out in January of 2016. And I've tried to get participation up. We've had discussions at some of these HR committee meetings, and we propose to have a two-tier program for 2016, meaning that if they earned their first 100 points to get their 2 required wellness items, we would award them the $100 gift card right away. And I will tell you, it did boost up the registration, and employees were really excited because I give those gift cards out on a once a month basis when I run the report. The second gift card, we even had 300 and some people have earned those already, and those were given out last month. We'll give the second round of second gift cards in December after the December 1st date. I will tell you, this is an overwhelming experience for our office, with just myself and one other individual trying to handle this and running these reports every month and getting out, 200 or 300 gift cards every month. It's quite overwhelming. Plus, you order the gift cards, you have to wait a month to get the gift cards. You got people calling wanting the gift cards, and then you got the other bunch complaining because they're getting taxed on the gift cards. What I would like to propose, and I've worked with Vivari over the last few years to try to move to a premium incentive, whereas once they earn their points in one calendar year, then the first of the following year they will earn a premium reduction. And
In 2018.
in 2018. So generally in October, I have to work out whatever our program design is going to be for the wellness program for the next calendar year. I work with Vivari and say this is, what we're going to do. So around October, we need to decide what we're going to do for 2017. And quite frankly, I do not recommend doing the gift cards. Besides the fact that it's overwhelming, it's a lot of time that's taken up to distribute, to order, to do the whole 9 yards of that. Get the information down to payroll. Payroll has to, they're inundated with it as well, to put it on the payroll, to get the taxes taken out. A premium incentive would, I think, number one, incentivize employees to participate, because if they know they're going to get a discount on their premium each pay period, it's going to affect them. I think we'll get more participation, and that's really what we want them to do, is participate and do the wellness items. And we had Aon kind of run some numbers as to what kind of a discount that would be. If the employee would meet their requirements in 2017, in 2018 their premium would be reduced by $25 a pay period. $25 a month, which is $300 a year, which is really more than they're getting now with the gift card, because the gift card is $200. If they have a spouse that participates, that would be another $25 discount on that level. So potentially somebody that's covering a spouse and themselves, they could get a $50 discount per month on their premium. And a lot, not only do I think that would be a better way to go to increase our participation, secondly, it doesn't take lump sum monies out of our medical fund, because right now the gift cards that I've ordered 1,600 gift cards since the first of the year at $100 a piece, which is $160,000 that has come out already out of that medical fund. Whereas it's going to be $25 or $50 less going into that. Plus, this is a pre-tax, medical premiums are pre-taxed, so it's not really going to ultimately affect that employee. If you give them a $100 gift card, they get about $60 of that gift card. Whereas now you're going to give them $25 less they're paying on their premium. That $25 naturally is going to be on their gross income to be taxable, but at a whole lot less amount of money that would be, a little effect on them. Plus, I believe, like I said, most employers are doing this already. This is really
how successful wellness plans.
Yeah.
So
Patrick?
So just really quickly, I believe that the unions will receive this favorably, although technically it is something that we have to vet with the unions. So I would ask that, in the interim between now and October, that Diana Marcos go to the unions and say, this is the plan, let us know if you have any questions or concerns. If not, we're going to move forward with it. So you would earn, during 17, you would do what you have to do to get the points, and then in 2018 is when you'd start getting the premium incentive.
Yes, and what I would request that you do that with them, and then make up an executive summary sheet that's very easy to understand. That, you know, this is what we have, this is where we're moving, this is the positive for it, and not only have Diane and Marcos use that when they talk to the unions, but send it out to the commissioners as well, so that we have it, because we may get calls too. But it's, again, if you have something, just a one pager, bullet, easy, pictures are nice.
Yep.
Clever.
For those of us
Dollars
unhealthy
in the wallet.
skeptics that don't come in for these things, because I don't want somebody to tell me to quit smoking cigars, do we really know that we're saving $600 on these couples that participate in the wellness program? Is it really worth $600 to the county to have them in it?
Well, I don't know that. I think we'll probably be able to start getting some statistics from Vivare now that we've been, let's see, 14, 15. This is our, you know, we're really right. Last month were 2 full years.
Okay.
The problem happens to be you're basing it on a very small group of individuals right now that are participating. I think that getting premium incentive is going to get more people on board. Maybe not necessarily the first year, but once they realize I can save $25 a month or I can save $50 a month on my premiums, and I hear about premiums, even though our premiums are pretty low, I still hear about premiums with individuals. I think we're going to get more participation for people to do these activities, and you know, we're not going to tell you that you can't smoke your cigars. Believe me,
I'm not going to give you the chance.
no, but
But we
we're
want
going to
you
get
to come in to
you.
do your screening.
You're going to get
and
your
check those
screenings
things.
done,
It
you know,
does
which
help.
is one of the
It does
what
help.
is the one main thing that we'd like to have our employees do is get their biometric screening. We're offering them at no cost to them. You know, now this year we're going to have them a second time in August and September. We're asking you to answer the member health assessment questions, and those are 2 requirements. We also would like and require for you to get your preventive care. Those the biometrics and your preventive care are going to be 2 things that are going to show if there's early stages of anything going on with the employee, which then we can assist them. Now we've offered the coaching, so we have coaching available to an individual. So if it is somebody that is smoking, that would like to quit smoking, they can tap into the coaching aspect with Vivare, and Vivare is going to help them. If it's somebody that is overweight and they want some nutritional help in coaching, they're able to get that as well.
Okay.
So we're not here to tell you to do or not to do, you know, things that may be good or not good for you. We're just asking you to do these things because we think we can help. And I can just tell you from my experience since we've offered the biometrics, I've had a handful of individuals, not a large number, but a handful of them that have directly come to me and said, I am so glad this happened because they found this out about my husband, or I found out I had onset of early diabetes, or I have asthma and I didn't know what was wrong.
Okay.
So I think it's just another tool that we have that can get early onset of something that's happening, and I think that a premium incentive will pull these individuals in.
I think that the data is real clear that if you can get people to move on preventative care, that you're saving money and it's more effective than waiting after the fact and
Right.
trying to deal with an event that occurs that you could have prevented.
Okay.
We already know that diabetes is an issue with our population. We know that heart disease is an issue with our population, you know, along with a couple other things that we believe that, and I think statistics show if you get in on the early part of that, you maybe can help them turn, you know, things around, you know, get them to watch their diet better, you know, get on a nutritional program, utilize the coaching, which we started offering the coaching in January of this year. So I just think it's the right thing to go. give somebody $100 Visa gift card, they forgot about the fact that they took their biometrics and their health and their members' health assessment. They're out there, maybe at the fast food joint, you just that $100. Whereas if this is something that hits you every single month for a reduction in your premium, I think the thought process might be a little bit different. Plus, it's not extracting large dollars of money out of the medical fund to pay for the gift cards. It's taking a little bits not going into the medical fund. So I think it's the right move, especially since we've started to get the participation levels up this year.
Thank you.
And so you're the perfect test.
Troglodyte.
person. Yes. So we'll keep an eye on you.
Just keep raising my premiums, lowering everybody else's. Eventually it'll come around.
The other thing is it's all voluntary, so we're not requiring you to participate. If
We
you
are
don't,
him now.
well, okay.
One exception.
We're not requiring Patrick to participate.
So-
If he doesn't
so
want to
basically-
participate, that's fine. He just makes the choice that he doesn't want a reduced premium.
Well, you didn't hear. The county board made a policy
Okay.
that all departments under the direction of the county board, including the commissioners, have to do it,
And their spouses.
and their spouses.
Well, and I think that's a
I
great
guess we forgot to
policy.
send you that.
Must have been
So-
last week while I was gone, huh?
Just don't put that in writing.
So I guess just to conclude it and wrap it up, all we're just doing is getting the consensus of the committee that this is what we want to. Obviously, this is something the county board will need to formally approve, but we want to just. And when would we do that? When would we have the formal approval?
Well, I'd like to do it before the 1st of October because
Okay.
I
But we
have
wanna
to work
get
with
the
Vivari to make this up and plan, and then what we do from that point, once we get the contract with Vivari and say this is the program design that we're going to do for 17, earning the incentive for 18, then we would present that, I would imagine, for the county board to approve. We then put together a letter that goes directly to the employee's home address explaining what the new program for 17 is going to be.
So and we'll get the union to input before that.
Yeah, oh, yeah.
Good.
Yeah. And then when you come to the board, I think a good presentation, PowerPoint of where we're moving, so everybody understands where we're moving is gonna be helpful. We'll just do it on a day Claire's not gonna do it.
Appreciate it.
Yeah.
And Vivari, their contract with us expires the end of this year, but they have given us notice that they would extend it for 3 years at no additional cost, so the rates will be flat.
Nice.
So we'll have that kind of all part of this.
Yep.
Good.
Good. Great.
Jolene got that for you too.
Good.
Yes.
Ah.
That's-
They wanted an increase, but she doesn't let them.
Good job.
Well, and then they also wanted to eliminate their per employee fee for coaching, as opposed, if an employee reaches out and wants coaching, we pay $125 for that person for the whole year. What they wanted to move to was a per employee per month cost. And I struggle with that because we only have about 36 that have reached out so far for coaching. That when I ran the numbers, it was just far out there that it wasn't worth it. And so she fussed with them. We kind of said, well, doesn't look like we're going to work with you then on this because we'll have to eliminate coaching because I can't justify to a county board to spend this kind of money when we have just this small amount. Now, I think coaching will improve with the population increasing, but they've agreed to, for us, just do that one-time fee per individual for the year. So I think it's a good thing.
And I don't take the insurance, so I
Right.
don't get the wellness piece of it. So is there, do they do a good marketing, if you will, of what's there for the employees?
If we get the employee to go out to the Vivari portal, and they each have their own individual portal, they sign up with a username and a specific password for them. I think the portal's excellent. I mean, you could probably speak to it a little bit better, but there is so many different things on a monthly basis that an individual can do. I get employees coming up to me and go, am I the top of the points? Do I have the most points? Last year, we offered the top 5 people an additional gift card so
But
that
I
they
mean,
would get.
How do we get that out to the population so that they know. I mean, it's kind of like when we do the food drive thing. People will watch where everybody is when we put out every Friday, you know, what department has so much. Although we have found that they're tricking where they're not reporting to the end. But, so that then incentivizes the other department, God, we gotta go out and get a case of corn. You know, and then that ups their numbers. So this, if we would work with them to have some kind of system that puts out kind of these incentive things for employees to do that, oh yeah, I think I'll do that.
We have 5 big, large bulletin boards throughout the county, one down on the Harney level,
Yeah.
where all of our wellness stuff, all the
Yeah.
flyers. Anytime we have a program going on where we have employer challenges, I send out a
Massive
flyer,
email.
massive email to those departments, and I think for the most part, most of those departments are really good. If you ever notice when I send those out, because I conclude the commissioners, I send them to department heads, elected officials, and then department designees.
Right.
Because sometimes we don't always get the department heads or elected officials to get that communication out to the employees. So those department designees are usually pretty good. So we do a lot of that.
When you, if the board approves the premium incentive, we could create a marketing piece. Bavaria could help you create a marketing piece. And as much as I don't like it, the most effective place to put communication is the bathroom stall. Put it on the wall of the bathroom stall, because everybody goes into the bathroom, they use the bathroom, and you're a captive audience. You can only look ahead.
I know
So
the building commission
They don't
will
allow
They wouldn't allow
They
that,
wouldn't
okay.
allow that.
They're pretty particular
Are they?
on where
And
we
I
can
know
put stuff.
somebody. Look at what a problem he is.
Go to-
2 things now.
Go to Boyle's, if you can
See-
get it for you.
Our other areas, like the health center and the health department, and, you know, those, they're very good about posting that just about everywhere that they can. In this particular building, I tried. I've even put it up, and they're just somebody calls immediately, and I have to take them down. Unless I can put it on the bulletin boards, you know, which I can, and I have, and get that signed off, there's really no other place that we can do that, you know.
Well,
We do
even
as
if
mu-
it was a challenge, you know, like, again, some of the things we've done to challenge the departments to get, you know, 100% of their employees and they get X or whatever. I don't know, we can talk about that later, but I just think that marketing I mean, it goes, all of the stuff that we're responsible for when it comes to public health, we talk about wellness. When it comes to employees, and that's what we're kind of preaching out to the public. Here we are at the county, and we should be,
the first
Yeah.
ahead of it.
yes.
Well, we'll send out during open enrollment, right prior to open enrollment, like the end of October, I send out a letter to everybody's home address, you know, no matter if you have the insurance or you don't have the insurance, to their home address, letting them know when open enrollment is. And that would be an excellent time to put something else in there with this new program and what the potential premium incentive savings could be for them. So.
Well, and it may be, again, we work with the unions because they're also very key in kind of gathering the employees, pushing the employees to do different or do the things you want them to do. So anyway, we can talk about that.
Great.
Okay.
Great.
I don't
So
think
everybody
there's-
okay with that one? Any other questions or comments? Any other business?
I don't think there was there?
Mhm.
Okay.
Okay, all right.
Thank you.
Then we
Good.
are adjourned.
Thank
What
you.
time is the other meeting at?
1:30.
Okay, thanks.
And back here again.
Back here.